I'm delighted to be here with Dr. Barbara Kubicka, founder of Clinicbe, and I know you're an expert in helping people look and feel good here at the clinic. I just wanted to ask you a little bit about the difference between cosmetic surgery and aesthetic medicine. I think most people will be familiar with the cosmetic term, but not so much with the aesthetic medicine. I wonder if you could just shine a little bit of light and tell us the difference or distinctions between the two.
I agree. Term cosmetic surgery, especially when it comes to surgery, have been around for a very long time, so people are familiar with that. And what they usually think about are the surgeries, so a big facelifts, the nose jobs, or any other surgeries or any other quite significant procedures, and they mostly based on the changing people appearance. Where term aesthetic medicine have been formulated not so long ago and applies to procedures that are done with the use of needles, laser, chemical peels, and they're usually small procedures. They are all still medical procedures, but they are things that we can do in up to probably an hour and a half, 2 hours.
So I can imagine that for many people, something like that is far more appealing, certainly initially.
Absolutely.
What are the kind of scenarios that somebody walks through the door here and to have those kind of aesthetic procedures? Can you give us a bit of an example of when people might find that appropriate?
So we treat different groups of people. So one big group will be the person who has a problem with skin. So whether it's acne, whether it's rosacea, whether it's scarring after acne, or just problematic skin, or they just would like to improve it. Then the second big group, it's people who would like to look better, whichever age they are, so aging as such, and whether it's a tiredness, whether it's a sun damage, lines and wrinkles in different ways, and as well the same thing about whether it's about the face, it applies to body, and then finally people who would like to improve their look. And we talk about slight improvements. We don't talk about the change, but sometimes small change, small improvement can create a massive difference.
I see. And so when somebody's coming through the door, what are the range of the different procedures that they might go through? And you pointed to all this, from chemical peels to things to improve the skin. Can you give us a bit of a flavour of that kind of journey?
Yeah, absolutely. So usually we start with the journey here in the clinic with a consultation. So we discuss based on the individual problems, on the patient problem, what we would like to proceed with. And as I said, for every condition there are numerous numbers of solutions, so we can choose from. But as you mentioned, from things like chemical peels, microdermabrasion, IPL or laser, they are very popular procedures when it comes to the skin care. Then we have a big group of injectables, so they are all treatments like dermal fillers or botulinum, which we use to improve the lines or improves the appearance of the face. We use as well a big number of procedures to improve the hair growth. So for example, whether it's a mesotherapy or PRP. And as well, we offer the advice for the skincare products or supplements, which can be obviously it's beneficial as well to combine with the procedure.
So there's a whole range of possibilities here. So just before we close, so presumably if somebody's wanting to go down either path, the most important thing, first of all, is to get good advice and to have a consultation with someone like yourself. Would that be the advice?
Yes, absolutely. That's the most important thing, to choose the right, suitable person for the individual.
Thank you so much.